Transfers. Welcome to our learning module on transferring your patient. By the end of today's course, you'll understand the following: how to determine the best methods to transfer your patient, how to safely perform chair-to-chair, bed-to-chair, and chair-to-bed transfers. Let's start by reviewing some terms we'll use throughout this course. Transferring is assisting a patient from one place to another, often from one chair to another, from a bed to a chair, or from a chair to a bed. Adaptive equipment includes walkers, transfer discs, wheelchairs, lift bars, and other devices to assist patients with safe transfer and ambulation. A gait belt is a specialty belt that is placed around a patient's waist. The caregiver then holds the belt to assist the patient to stand or to steady them. A transfer disc is a round, flat disc placed on the floor that spins and is used to assist patients who cannot pivot. Physical therapists, or PT, specialize in safe patient movement as well as assistive device use. Today's course will focus on transferring patients from a bed to a chair to a chair, or a chair to a bed without using specialized lifts. For more information on how to use specialized lifts, see our transfers course in Build Your Own course. Your healthcare team and physical therapist can assist you in evaluating the most appropriate transfer method. They will determine this based on your patient's strength, balance, ability to follow directions, or need for adaptive equipment. Always follow the healthcare team's instructions when transferring your patient. The steps to safely performing chair-to-chair, bed-to-chair, and chair-to-bed transfers are all the same. Perform hand hygiene. Discuss the transfer with your patient and ensure they understand the plan for transferring them. Make sure that you and the patient are both wearing non-slip footwear. If the patient requires adaptive equipment, such as a cane, walker, or wheelchair during the transfer, place it within arm's reach. If the patient is lying in bed, assist them to sit up and to the edge of the bed. Stand beside the bed, facing the head of the bed. Assist the patient in turning onto their side so they're facing you. Place one hand behind the patient's shoulder and the other behind the patient's knees. Encourage the patient to push themselves up with their elbow as you assist them by moving their legs off the side of the bed and lift at their shoulder. Allow the patient to rest for a moment and make sure they do not feel dizzy or lightheaded from the change of position. If you intend to use a gait belt, place it on the patient while they're in a seated position. If you are using a transfer disc, place it on the floor under your patient's feet. If you're transferring the patient to a wheelchair, pull it close to the patient, minimizing the transfer space, and lock the wheels. If you're transferring from a wheelchair, pull it close to where the patient will transfer to and lock the wheels. Stand in front of and face your patient with your feet 12 to 18 inches apart. When you're ready to assist your patient to a standing position, bend with your knees, keeping your back straight. Instruct the patient to push themselves up by pressing down on the bed or arms of the chair on 3. Hold on to both sides of the gait belt as you count 1, 2, 3, and lift the patient. If the patient is on a transfer disc, you can turn their body so that their chair or bed is now behind them. If the patient is not on a transfer disc, Instruct them to turn their body so that their chair or bed will be behind them. Encourage the patient to move their feet and not just twist their body. Once the chair or bed is behind the patient, instruct them to back up, if possible, until their legs reach the chair or bed. Instruct your patient to reach behind themselves and place their hands on the arms of the chair or bed as you assist them in slowly lowering to a seated position. As you assist your patient in transferring to a bed or chair, there are some tips that you can use to stay safe. Never lift more than you are able to. If the patient is too heavy for you, request assistance from the healthcare team. This should be evaluated by physical therapy initially and on an ongoing basis so that their level of assistance is accurate. Assistance levels can range from a 1 to 2 person transfer to a full or partial assist, or assist with or without an assistive device. Talk to your patient throughout the process. Remind them that you are supporting them and won't let them fall. Encourage your patient to push down on the floor with their feet if they have difficulty bearing weight. If your patient is unsteady or lightheaded upon standing, help them sit back down and wait a few minutes before trying again. Never allow a patient to hold onto you around your neck. If your patient has difficulty understanding instructions or speaking due to dementia or other diseases, try singing your instructions to them. For instance, when I count to 3, stand with me. 1, 2, 3. The brain processes music and speech differently. Some patients can understand music better than speech. Remember to bend with your knees, keeping your back straight. Report any back pain that you experience to your supervisor or your medical team immediately. This concludes our module on transfers. We hope you've gained a better understanding of how to determine the best methods to transfer your patient and how to safely perform them.